Hi everyone. Today I want to talk about something that really stood out to me while learning more about our healthcare system. Something that's both fascinating and deeply concerning. The United States spends more money on healthcare than any other industrialized nation, yet our health outcomes are among the worst. We have a shorter life expectancy, higher maternal mortality, and greater disparities in access to care. Even with all of our technology and innovations, the results don't match the investment. And to make matters more complex, we're seeing more private equity firms buying hospitals and healthcare systems. When profit becomes the priority, patients often pay the price, sometimes literally, through higher cost, but also through poorer outcomes, staffing shortages, and reduced community services. That was the most surprising and unsettling part for me. Realizing how business decisions can shape something as fundamental as people's health. So, how can I use this information in my work right now? First, it reinforces the importance of being an advocate for value, not just volume, in healthcare. Whether it's in clinical care, public health, or administration, we need to question whether the systems we support are improving health or simply generating revenue. Second, it strengthens my commitment to community-based and preventative approaches. If the U.S. is spending so much, yet achieving so little, that tells me we're investing in treatment rather than prevention. The most meaningful improvements in health outcomes happen when we address social determinants, like stable housing, food security, education, and access to preventative services. Third, it highlights the need for transparency and accountability in healthcare financing. Understanding how ownership, reimbursement, and profit models affect care delivery helps us advocate for policies that put patients first. When private equity firms buy hospitals in rural or low-income areas, services like maternity units or behavioral health programs are often the first to close. We have to push back against those trends by promoting models that reinvest in communities rather than extract from them. Finally, I can use this knowledge to encourage conversations with colleagues and future healthcare professionals about what quality really means. It's not just about new technology or high patient turnover. It's about meaningful outcomes, longer, healthier lives, and equitable access for all. So what do I want to remember in 5 years? Well, 5 years from now, I want to remember this. Spending more doesn't mean we're doing better. I want to remember that the true measure of a healthcare system is not how much money it makes, but how well it serves its people. I hope I'll still be working to bridge gaps in access, especially for rural and underserved populations, and continuing to question whether our policies align with the values of equity and compassion. And finally, I want to remember that change happens when people within the system speak up. Whether it's supporting immediate postpartum contraception programs, advocating for fair housing, and fair hospital reimbursement, or protecting patients from corporate-driven cutbacks. Every effort matters. So as I continue my professional journey, I'll carry this perspective with me. The health of our nation depends not just on how much we spend, but how wisely, ethically, and equitably we spend it. The reality is that our healthcare system reflects our priorities, and the imbalance between cost and outcome shows we have work to do. Real change means demanding a system that serves people, not profits. Through accountability and advocacy, we can support policies that emphasize prevention, transparency, and community-based care. I want to be part of a generation of healthcare professionals who challenge the status quo and push for equitable access. Healthcare should never be a privilege defined by profit, but a system grounded in dignity and compassion, where everyone has the chance to live a full, healthy life. Thank you.